welcome to uh, Bioness integrated therapy system. I'm going to use this Bioness integrated therapy system to um, work on my project, which is effects of Bioness integrated therapy system on the balance of cardiovascular accident patients. Um, so it's very important that we understand how the beats work. Um, Beats was designed to challenge the visual, cognitive, as well as the balance deficits that most neurological patients experience. Not just neurological patients, we have myriads of cases that may require the therapist to challenge or to work on the balance or visual or cognitive problems that these patients may come down with. So it's very important in terms of this project, which is seeking to check whether the beats as claimed by the producers, whether the programs that challenge balance per se, it's able to produce changes in balance that would be meaningful to both the patient and as well as the clinician. So what this project seeks to do is that it wants to look at the minimum detectable change and the minimum clinical difference. Those are the indices that it wants to look at based on established researches that have been done that have established these particular indices. So it wants to use those indices to see if the changes are what you know what the company claims. So in order to understand how to use the beads, you have to log in. The power button is behind, so you want to put on the power button, and then there are logins. I already did this, for the sake of protecting um, the passwords of my institution. So I just keep that. So next thing is to understand how to put in the patient information or your client information. Sometimes I want to go through start therapy and I want to do add ID. So this is where I have to put in all the information of my client so I can have a keyboard where I can type. For instance, I'm going to use my name. ID, I'm going to generate a random number 1, 2, 3, 4, 5, 6. And I'm going to put in my name, my first name, and I'm going to put in my last name, and I'll put in my date of birth, and when I'm done, I click on done, and I put in my gender, and it's always important to look at the dominant hand. So if I am right-handed,